Hello, everybody. This is Joe Freudenberger, CEO for Oak Bend Medical Center in Richmond, Texas, coming to you today with our weekly Cup of Healthcare Joe. So, I spoke last week about the fact that the Medicaid program pays pretty poorly, and therefore is not normally a target for a lot of folks who have ill intent. The Medicare program pays better. It is tightly governed by the government. And so while there is the potential for abuse, the more common issue that occurs with both of these programs is not so much abuse as excess use. And as I talked about last week, what excess use means to you, who is a patient, might look completely different than what excess use might look to an external person. As an example, as I gave, an MRI is not necessarily the first tool that should be used to examine you for back problems, but if you feel like it's the best tool, then it really doesn't matter what should or shouldn't be done from your standpoint. That's the tool that should be used, notwithstanding the fact that it is one of the more expensive tools to use for that purpose. So that's what we see a lot of in the Medicare program, people asking for and doctors ordering things that sometimes in hindsight are not considered to be necessary, especially on the procedural side. In fact, there's some analysis that suggests that up to 30% of the Medicare program spend on an annual basis is what would be categorized as convenience needs, not necessarily true medical needs. And therein lies the big challenge. In our world, in our democracy, we believe that we paid for certain services, Medicare being one of them, and therefore we're entitled to receive the benefits of that, notwithstanding the cost. So therein is our challenge. On the commercially insured side, the Uniteds, the Aetnas, the Cignas, the Blue Cross, they spend a tremendous amount of money ensuring that unnecessary services are limited as much as possible and that there are extensive programs to detect any type of fraud that might exist. So this is a more controlled system as our healthcare system than a lot of people realize, but we'll talk more about it in subsequent blogs. Talk to you soon. Have a great day.